Mongolian Red Cross Society in 2017. Disaster Management Program assisted 5,480 herder households of 13 provinces affected by Zut disaster with unconditional cash grant, animal mineral kit, hay, and winter shelter assistance of 2.8 million tugrugs in cooperation with IFRC, British Red Cross, and USAID. With grant from the state of Kuwait, Mongolian Red Cross Society assisted 35 households of Bayangulli province affected by flood with winter house, public bath, toilet, community hospital, playground for children, and a mosque worth of 660 million tugrugs. With support from ECHO, Finnish Red Cross, and NEMA, conducted an earthquake response of Ulaanbaatar city simulation exercise with the presence of all district local emergency management agencies. 320 volunteers of 21 provinces were trained in responding to disasters and emergencies. Social Care Program. Within providing social care services to most vulnerable population project, funded by the British Red Cross, Mongolian Red Cross Society reached 2,280 people of 8 provinces and districts with social care service through 760 trained volunteers. Within integration of violence prevention and response program for women, adolescent, and children project, supported by the Australian Red Cross, MRC has established 4 multidisciplinary groups and reached 300 people through 100 volunteers. Health Promotion Program. Tuberculosis Care and Prevention Among Homeless People of Ulaanbaatar project, supported by the Global Fund, MRC has organized 23 screenings among 2,500 people. In total, 55 TB cases were detected and 16 patients are hospitalized for treatment. Through Angel's Journey in Mongolia project supported by Red Cross Society of China and Chinese Red Cross Foundation, 48 children born with congenital heart disease successfully received free corrective surgery at the hospitals of Beijing and Huhhot City of People's Republic of China. Organizational Development. Through organizational development support from Japanese, British, Australian, Finnish Red Cross, and IFRC, 10 mid-level branches received financial support of 327 million tugrugs to enhance their resource mobilization activities and working environment. Mongolian Red Cross Headquarters undertook branch organizational capacity assessment at 27 mid-level branches. 63% of the mid-level branches have reached benchmark. General account of 2016 has been audited by PwC and Odbortil. Mongolian Red Cross Society was advertised 11 times on daily newspapers, broadcasted 24 times on Mongolian National Broadcasting TV, 3 times on UBS TV, 24 times through TV5 channel, 54 times through TV9 and other channels. Youth Training Center. The government of Mongolia, Red Metal AG, have invested 860 million tugrugs for the Youth Training Center. East Asia Regional International Humanitarian Law Training has been held at the Youth Training Center with support from ICRC. 28 delegates from 5 countries participated in the training. IFRC Asia Pacific Regional Disaster Response Team training has been organized at the Youth Training Center. Delegates from 38 countries participated. East Asia Youth Camp Gathering under the theme of climate change has been held at the Youth Training Center. 105 youth delegates of the East Asian countries participated. Partnership and Cooperation. Mongolian Red Cross have signed an MOU with the Ministry of Education, Culture, Science and Sport, the Ministry of Labor and Social Protection, and Ministry of Health. Meeting of State Red Cross Cooperation Council has been held twice. The members of Cooperation Council have been renewed with the Decree number 87 of the Deputy Prime Minister of Mongolia. 10 delegates of the Mongolian Red Cross successfully participated the IFRC statutory meeting held in Antalya, Turkey. Mongolian Red Cross displayed exhibition about the activities of the Mongolian Red Cross. The president of Italian Red Cross Society, Francesco Rocca, visited Mongolian Red Cross and signed an MOU. Francesco Rocca has been elected as the president of IFRC in November. Total number of people reached. Disaster Management Program, 102,838 people. Social Care Program, 73,515 people. Health Promotion Program, 42,072 people. Youth Movement, 145,500 people.